I'm really doing that. And
You're ready to go.
All right. So ready, right?
Yep.
Welcome to the October 9, 2025 meeting of the Health and Environment. My name is Rupal Kakad and I'm the chair of the committee. Tonight, we are joined by Assistant District Manager Brandon Berth. This meeting is called to order at 6:33 p.m. As a reminder, New York State law requires all committee members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, you can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there is time following the committee's discussion, we will field questions from the public. So we need a volunteer to take minutes tonight. If you're able to take minutes, let us know. Brendan, do we have either Kat or Liz coming in today?
I even if, let me check, I'm pretty sure at least. I mean,
we can.
And I know you did it last month, so you're
I
off.
can do
the
it,
hook.
Rupal.
Oh,
I'll do
okay,
it.
are you sure?
No
Thank
problem.
you. All right, so Gloria will take the minutes. All right. We will now take attendance by roll call. Brendan will conduct the roll call.
committee members, I will call your name. Your name is called, please say present. I'll announce if there is quorum. Marty Barrett,
Present.
Elmi Barroso,
Present.
Liz Burr, I don't see yet. Barack Friedman,
Present.
Gloria Hay,
Present.
Rupal Kakad,
Present.
Kevin McKeith, I don't see yet. Mubin Siddiqui is
In the
In the other room.
in the other, yeah, she will be here. And Kat Valero, I also don't see yet. We do have a quorum.
So the agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objection, the agenda for tonight's meeting is adopted. The minutes from the September 11 meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the September 11 meetings are adopted. They will soon be available on CB6 website. Some ground rules. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members who are here in person, if you have a question about committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Committee members unable to attend in person, if you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. All committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information like an email address that was already stated aloud on the record during the meeting. All right, so the first agenda item for today is the presentation from the mayor's office on Be Heard, which is the behavioral health emergency assistant response division. For the presentation, we have Paki Kane, Deputy Executive Director of External Affairs. Paki Kane possesses a rare blend of career experience within the government, private, and nonprofit sectors of New York City. Paki is strongly knowledgeable in the areas of external affairs, health and human services, public policy, intergovernmental affairs, communications, and project management. Her work is widely known and trusted among government leadership, elected officials, nonprofit leaders, and community members. Paki is a proud mother and Indian immigrant and resident of East Harlem. She was named one of City and State's 2024 Who's Who in Government Relations and graduated from Columbia University with her master's in social work. We also have Simone Watson, licensed mental health counselor, senior director, mental health access and crisis response. Simone Watson is the Senior Director of Mental Health Access and Crisis Response at the New York City Mayor's Office of Community Mental Health, a role she has held since November 2023. With over 15 years of experience in child and adolescent psychiatry, she previously served as the Associate Director at Bellevue Hospital Center within New York City Health and Hospital. Simone is a licensed mental health counselor in New York State and holds a Bachelor of Arts degree from Utica University, as well as Masters of Science in Counseling from Mercy University. So that's.
Hello everyone, I'm just going to share my screen. Just give me 1 second. You all able to see?
Yes.
And let me put it into. And are you able to see the slides?
Yes, we are.
Great. And so I will turn it over to Paki.
Thank you, Simone, and thank you, members of the community board. My name is Paki Kane. I'm Deputy ED of External Affairs at the Mayor's Office of Community Mental Health. I'm joined by my colleagues.
Paki, the volume is a little low.
Sorry. Is that a little bit better?
Yes, that's better.
Okay. All right.
Thank you.
Yeah, no, absolutely. I am joined by my colleague Simone Watson, and also want to acknowledge our colleague LaQuisha Grant, who's also on as well, who's a fellow Deputy Executive Director in the Office of Community Mental Health. Simone, do you want to just go to the agenda slide? Thank you. So we have a couple of things we're going to be talking about today. We're going to be talking mostly about the mental health crisis system in New York City and the ways in which New Yorkers who are experiencing a mental health crisis can access care. We are also going to be talking about 988, which is a national hotline, but it's New York City's mental health hotline, which is accessible 24/7 and is there for those experiencing mental health crisis or seeking support. And then, of course, we're here to talk about Be Heard, which is the city's first ever health-centered emergency response system. And then we want to close out by talking through other areas of care and support that New Yorkers can access. And we do want to leave a little bit of time for questions as well. Next slide. So we have a couple of slides here just on our office and some of the things that we do. And there's a lot of words there that, we sort of try to think through when we think about the Mayor's Office of Community Mental Health. But the way that I like to think about it is really through a couple of main sort of pillars. And it's 4 main pillars, actually. And the ways that I kind of think about it is through equity and access, community partnership, which is why we're here this evening, workforce development, and care coordination. So I'm going to, sorry, did someone say something? Sorry, I thought I heard a question. What I'll do is I'll walk through each one of these just a little bit, and then I'm going to turn it over to my colleague Simone to talk about our crisis response system in New York City. And so the first pillar that we think about when we think about the Mayor's Office of Community Mental Health and the work that we do is ensuring equity and access for all communities. And so we know that members throughout New York City experience both crisis and access in different ways and through different through the different sectors. Excuse me. So sorry. Sorry about that. Sorry, can everyone hear me?
Yes.
Yeah.
Okay. And so what we think about when we think about the Mayor's Office of Community Mental Health, first and foremost, equity and access. We want to make sure that those who are experiencing crisis are have the access that they need and that they're receiving it in the same way throughout New York City. The second is community partnership. We want to know that the systems that are being accessed are being done in true partnership with community, which is part of the reason we're here this evening. And then we want to think through and we want to think through and make sure that we address any gaps in the workforce of behavioral health and mental health in New York City. So we're always thinking of ways that we can expand access, expand the behavioral health workforce, and also provide the support and resources and professional development that the workforce may need. And lastly, and a lot of what we're here to talk about this evening is care coordination and access. And so with that, I'm going to turn it over to my colleague Simone, who's going to talk through the care system in New York City for crisis. Simone?
Thank you, Parky. So this is a great example of how the behavioral health crisis services throughout New York City are kind of broken down into what we identify as 3 pathways to receive care and treatment. And so I think that people are very familiar with our 311 in terms of, oftentimes we don't think of 311 in how we can get services related to behavioral health. And so when you do call 311, you are able to get assistance for someone who's experiencing mental health crisis, who is living on the subway or is perceived to live on the subway or in the street, and they can dispatch to a homeless outreach team such as PATH or Scout, and they're able to meet that individual at their location and provide a quick assessment and encourage any housing solutions that might be needed, whether it's temporary housing or connection to care. And those teams are often run through the City Department of Mental Health and Hygiene. And then we have 988. And so through 988, as Paki mentioned, is a national hotline. But we really want to emphasize the ability to receive care and referrals through our 988 system for urgent matters. And so 988 is called and helps. When 988 is called, someone on the line is able to perform risk assessments and some form of de-escalation to the individual who is calling, and the individual might be calling for themselves or for an individual, a loved one, or someone that they have witnessed is experiencing a behavioral health crisis. And so the 988 counselor is able to de-escalate, make an assessment, and can also connect the callers to services based on the risk and need that is found. And in this chart, you'll see the 4 different options that the 988 caller is able to make referrals to. And so at first, the first option is our mobile crisis teams, also known as MCTs. And so they're able to respond to people who are experiencing mental health crisis and are unwilling or unable to engage in care. And so they are able to go to the individual location within 2 hours. So it's not immediate response, but within 2 hours, and they're able to engage them in care as well as de-escalate a situation in person. There's also an option for crisis residents and supportive connection centers, which provide an alternative to psychiatric hospitalizations. And so crisis residents are voluntary home-like facilities that provide short-term services and are supportive alternatives to psychiatric hospitalization for those who are experiencing mental health crisis. And crisis residents offer 24-hour, 7 days a week staff and peer support in a safe environment, and allows the individual to recover and receive help developing coping skills. And adults are able to stay in these crisis residence centers throughout the city for up to 28 days. And there are a few crisis residence centers available for children. Of course, that is something that is less accessible due to limitations of how many there are throughout the city, but the children are able to stay there for up to 21 days. Another alternative to crisis residences are supportive connection centers, and they're able to give first responders an alternative to avoidable emergency room visits or sometimes criminal justice interventions. And so those centers offer short-term clinical care as well as non-clinical services to people with mental health and substance use needs. And so these SCCs are able to provide and promote community-based, person-centered engagement and stabilization and connection to services. The unfortunate thing is that currently we only have one support and connection center in the city, which is in East Harlem. And so OMH, the New York State Office of Mental Health, is working to kind of shift the model a little bit and have crisis stabilization centers as opposed to expanding support and connection centers at this time. And so the crisis stabilization centers are still in process of implementation throughout the city. We also have outpatient services, so 988 counselors are able to refer the caller to outpatient services where they can provide crisis support for the individuals who are already being treated in a clinic. So sometimes someone can call 988 who already has a therapist or a provider in the community, but they're unable to reach them in an urgent manner, or they decided that they would prefer to speak to a counselor in 988, that counselor is able to refer them back to their provider or to another community provider if they have not been in treatment. And then lastly, under 988, they're able to connect people to comprehensive psychiatric emergency programs and psychiatric emergency departments that provide emergency psychiatric care in hospital settings. Another option are our co-response teams, or CRTs, and they offer pre- and post-crisis support services to people who have behavioral health challenges and are at risk of harming themselves or others. And then we have 911, which everyone knows is what you're supposed to call. What we have been taught, right, to do is call 911 when there's an emergency. And so we still want people to call 911 when it is an emergency, when a person is experiencing a behavioral health crisis that causes a public safety issue, which includes being a risk of harm to themselves or others. And so when 911 is called, there's automatically a police response, right? And emergency medical services are present to offer transport to the hospital for emergency evaluation and potential admission to inpatient services. And within that umbrella, as Paki mentioned, we have the Behavioral Health Emergency Assistance Response Division, also known as BHEARD, which responds to mental health crisis calls made through 911 and the 911 system. And we respond and help to de-escalate some behavioral health crisis and provide immediate care. And so, as I mentioned, when you call 911, when you call 988, it's we want you to encourage the community to call 988 in an urgent mental health crisis. And you should call 988 when it's an immediate crisis counseling is in need, when there's a need for connection to ongoing care, when someone needs urgent attention and needs to speak to a counselor that can do a quick risk assessment and determine the next level of care or referral that's needed. And when you call 988, as I said before, the counselor answers, as well as if you request, there are some peer specialists that are available, and those peers are people who have lived experience, and sometimes an individual might prefer to speak with them because they feel like they can be heard and are someone that they feel they can relate to in their journey. And we also have English, Spanish, and interpretation available when someone calls 988 in need of assistance. And so how do you call 988? You can call 988 to request a team for mobile crisis. You can text 988, or you can also chat online. And so we mentioned the mobile crisis teams, and they include a clinician and peers. They arrive within 2 hours to the location to assist the individual. And unfortunately, they're only available from 8 a.m. to 8 p.m., but they are available 7 days a week for assistance. And they provide behavioral health support, de-escalation, and assessment, as well as connection to ongoing care. And so, as Paki mentioned, our Be Heard is the New York City's first ever health-centered emergency response. And so every 3 minutes, a New Yorker reaches out to 911 for mental health assistance. And historically, these calls have received a response from NYPD and FDNY EMS, and resulted in a transportation to the hospital emergency room or hospital emergency department as the only option for completing a mental health assessment and connecting the individual to care. So the city dared to reimagine an emergency mental health response that could arrive in minutes to an individual in crisis, and an option that our system previously lacked. So in November 2020, when the Behavioral Health Assistance Response Division, also known as Be Heard, was announced, a lot of the country was wrestling with a similar question: how to prioritize mental health in the emergency crisis response rather than focusing solely on public safety. And so our answer, the city's answer, was to pull together 2 operational agencies, FDNY EMS and New York City Health and Hospitals. And this combines FDNY's EMS's infrastructure and experience responding to emergency calls, because they've been responding to mental health calls and mental health crisis calls. So we combined their experience with New York City Health and Hospitals' extensive mental health service delivery system, which delivers over 60% of the behavioral health care in the city. And so the result was the creation of the new option for people in crisis, and to new option for people in crisis as an interdisciplinary team, where 2 EMT workers are paired with a mental health professional to respond as a single unit to a 911 mental health calls that do not have any violence or risk of harm to self or others, as well as no evidence of weapons as a primary concern. Be Heard teams have a lot of experience and expertise to de-escalate crisis situations and to respond to a full range of medical and mental health problems. They assist the individuals in crisis by providing immediate mental health professionals. With the goals of Be Heard, we have 4 main focus areas, which include to route 911 mental health calls to health-centered response when appropriate, increase connection to community-based care, reduce unnecessary transports to hospitals, and reduce unnecessary use of police resources. And as mentioned, with what do Be Heard teams do? We provide behavioral and physical health assessments, as well as providing assistance on site in real time and referring individuals to community-based care locations. So this is just a map of where Be Heard operates. We operate currently within 31 police precincts and surrounding areas. As you can see, we're not, unfortunately, in Staten Island, and we're not in all areas of Manhattan, but we are covering all areas of the Bronx. For this particular community board, we are not directly in one of your precincts. but we are throughout the city and other boroughs. And this is just a quick slide to show some of the Be Heard data that encompasses fiscal year 24. So more people were served by Be Heard teams from July 2023 to June 2024. There were 14,951 911 mental health calls responded to in the pilot areas, and 40% of them were eligible for Be Heard. And Be Heard responded to 53% of all eligible calls. And then we just have a little bit of outcomes data where we can see that 57% of our calls were transported. 50% of the calls Be Heard responded to were transported to the hospital, and 43% of them were served in the hospital. And everyone is offered some form of follow-up care. And so New Yorkers at risk of crisis may benefit from ongoing behavioral health care. And these are just some resources to share with the community on how to find ongoing care, because ongoing care is a very big prevention in terms of preventing crisis, right? We can't control a crisis from happening, but someone being in treatment is a very beneficial to their ongoing wellness and care. So we have 988, which we talked about extensively, the ability to call or text or chat with them. We have NYC Cares to assist with finding providers, and Express Care. New York City Health and Hospitals offers Express Care, which is a virtual mental health and substance use urgent care service. And so you're able to call it, or you're able to call it or go online. And 988 and 911 if someone is in imminent danger. And if you have any further questions, or you would like to share resources with the community members, you can visit our website at mentalhealth.cityofnewyork. And we have a mental health toolkit that they're able to look through and see some of the resources that we have related to specific populations, as well as information on who to call when in crisis. Thank you. And these are our QR codes that direct you to our websites and social media platforms.
Thank you. Question, Marty?
Are the 988 clinicians local, or they're somewhere in the country, or?
So they have call centers in New York City. Yes.
That was a great presentation, so thank you for educating me. Yeah, I never heard of 988. So thank you.
Oh, really? Well, this is
Yeah.
great then.
I feel
Mission
very
accomplished.
uneducated. But thank you for educating me.
You're welcome.
So it sounds like, since it takes like 2 hours for 988 to come, it's more like for the person in the crisis to call. 'Cause I assume I saw somebody in crisis, I think it would be hard, like on the street or something. Do you agree with that, or?
So it doesn't take, I just want to clarify that it doesn't take 988. 988 is not directly responding to your request or your concern for an individual, right? It's a pathway that connects you to a counselor that's able to then make the connection to whether it's 911 because it's an emergency, or it's like you mentioned, if someone's maybe in the subway and you're concerned about them, or on the street homeless, they'll send out a variation of teams. Mobile crisis is one that's not immediate necessarily, right? They come within 2 hours. So there are other options of immediate response, depending on the assessment of the counselor that you speak with.
Yeah, and
Sorry,
Gosh,
just
no,
to
please.
jump in and clarify a step further. Simone's exactly right. But mobile, to your point, mobile crisis teams do not respond to people who are on the street. So just kind of as you were suggesting, this probably wouldn't be the right resource for somebody who you see on the street experiencing a mental health crisis. For that, if you think that person is unhoused, then you would call 311, and a homeless outreach team would respond to that. But mobile crisis is for, you can make a referral for someone that you might know who is in crisis.
Thank you, that's very helpful, thanks.
You're welcome.
Thank you so much for your presentation. Wonderful work. I have a couple questions. One is, why is Be Heard not available in all of New York City? That's the first one.
Mhm.
And the second one, if you don't mind me throwing that one out there too, is, you said you responded to 53% of eligible calls to Be Heard. I'm just wondering what happened to the other 47% and how you're deciding what calls you're actually making when you get those requests.
So I'll start with why Be Heard is not all over this, is not technically citywide. So I would say, sorry for the pause, but so there's been a pause in expansion, and so currently we're not citywide because of the pause in expansion due to budgetary cuts that were made in 2023 and fiscal year 2024. And so at this time, we cannot expand officially citywide, unfortunately. And the reasons that we are currently in the precincts that we are in is because we looked at the data around the 911 calls for the citywide, that for people with having mental health crisis. And so we started in those concentrated areas and gradually expanded. And unfortunately, we had to pause at this time.
Yeah, that's unfortunate. Yeah.
Yeah. And so could you refresh my memory with the second question?
Yeah,
Oh,
the
why?
second one, yeah, the 53 response rate to the, what would be eligible for a Be Heard
Mhm. So
call
there are a
out.
lot of variables that come into play in regards to the number of calls that Be Heard is assigned to and able to respond to. 911 is a very big call system, right? And so there's a lot of prioritization in terms of the way that calls are dispatched. And so one of the variables includes staffing, right? And having the number of call takers that are able to screen for the calls for the Be Heard assessments that come through the 911 call center. So the screening process is really key to being able to identify which calls meet the requirement or the criteria for Be Heard, in addition to the pilot areas. And so the other component of staffing is the workforce challenges that we've had, not only with the nationwide workforce challenge of mental health providers and clinicians, I'm sorry, but also within FDNY EMS, there's such a shortage of EMTs staffing, which also becomes difficult. So in terms of onboarding and having enough units, that becomes a challenge. And so we are not able to make necessarily all of the calls that are eligible within our pilot areas for some of those kind of foundational reasons.
Thank you. That makes a lot of sense. Thank you.
You're welcome.
I have a question too. So when you call 911, the 911 dispatcher, right, the person who answers the 911, are they also being trained into how to identify these calls?
So the 911 call takers are trained and aware of Be Heard. However, the primary screening really takes place at the FDNY call taker level, right? Because when you call 911, their immediate questions are related to how fast they can dispatch to the appropriate units, right? So they're going to ask you whether you need medical, police, or fire. And so once you say medical, it's then transferred over to the FDNY dispatchers who are able to ask more questions and get more information to determine what level of response is needed and whether that includes Be Heard and the pilot area that encompasses them.
Thank you. On average, when a Be Heard team does respond to a call, do you know on average how much time they spend with an individual trying to help them, trying to connect with them and, you know, trying to basically find them resources to a point where they are able to, like, let's say,
Mhm.
listen or like respond in a positive way?
Sure. So I think one of the things I love most about Be Heard is that despite it coming out of the 911 system and um, working with the EMTs, you know, FDNY, they are able to take their time with the individual in crisis, right? There's no real constraints around how much time they need to take to de-escalate a situation. The mental health clinician really is able to meet the individual where they are. And of course, if it's urgent and they need to, let's say they need to transport to the hospital, that's able to be done right away if they are able to make that assessment right away. But they also have kind of a little bit of luxury of time to be able to really invest in the de-escalation skills and tactics that they've acquired through their experience. And so it varies case by case. Sometimes you know right away that someone needs immediate evaluation at a higher level, and so you request for them to be transported to a hospital facility, but they can spend anywhere from half an hour to, you know, a little more than that with an individual if needed.
And do they all like, do they get taken to the hospital or it just really depends on case by case basis how that call or how that situation ends?
So no, they don't all go to the hospital. In one of the slides, I shared that at the time, a little bit over 50% of them go to the hospital, of individuals that receive a Be Heard response go to the hospital. So, I mean, it is a good portion of individuals that might need a higher level of evaluation. However, that's not all cases, right? Some people are able to be de-escalated and supported in the community or transferred to an alternative care, such as the crisis stabilization centers or the support and connection centers, or they're able to be reconnected to their provider, and a follow-up appointment is made.
Thank you.
You're welcome.
I think we're all done
That's
with
great.
questions. This was a great
Great, yeah.
presentation.
Thank you.
Really, really helpful, answered a lot of our questions and yeah.
Great. Glad we can be of help.
All right, thank you very
All right.
much. All right,
Thank you. Have a great night.
Yeah.
Bye-bye.
Bye. Great. So on to anybody, yeah, so we're just, anybody have anything, thoughts, comments on anything? Cause I was initially gonna think like maybe we can have them see if there's a way to expand it, but that's obviously not gonna happen. That's obviously not the case, so.
Yeah, when they came to us in 23,
April 2023.
yeah, they were just in one or two,
Mhm.
Okay.
district, in North Harlem. And they were hoping to expand at that point, but again, the issue was money and the availability of clinicians.
Yeah.
My wife worked for OMH for 38 years. She left when Andrew became governor, that she didn't want to work for him. At that time, this was by 2010, there was not enough clinicians and, to staff the different agencies that were, the independent agencies that were providing care. And it was always a problem and, without a master's, you really can't do much.
Mhm.
And, people aren't going into it, and burnout is tremendous.
Yeah, I can
For-
imagine.
For the first 6 months of, a person being a social worker or a psychologist, they're all gung ho. And then when they see how things aren't changing, it's
Yeah.
tough.
I can imagine the mental health toll it takes or just the burnout it takes, so,
Yeah.
all right.
Just have one question, like at full board last night, two constituents said, oh, there's homeless people living under the FDR or something like that. And Brendan, I assume you get calls about this kind of stuff.
Yes, we do.
And you just refer them to 311. Is that what you do next?
Yeah, so I asked them, like, when someone comes to our office with such a concern, I asked them whether they've reported it to 311. If so, what is your 311 reference number? The reason for that being that our sibling agency, the Department of Homeless Services, when we reach out to them about an unhoused individual, they will ask us, do you have a 311 number? And if they don't, their teams can't really come out. So it's 311 that prompts teams to come out.
But the challenge is I've tried on different occasions for other reasons called 311, no one ever picks up the phone.
Yeah,
There's
so-
very low response rate there.
Yeah,
Mm.
I personally use the, use the online forms. Jesus swears by the 311 app.
I see.
Yeah, I also find calling 311, like, on the phone to be very cumbersome.
I've heard the app is better too.
And also they refer you to 911 half the time when you do get them. And then 911 says no, call 311, so it's like a.
Yeah, I've experienced that too. Yes, yes.
I've called the office in regards to, there were several people, sleeping or living on the Esplanade from 53rd Street on up. I called the office and the next day, none were there.
Hmm.
So
Oh,
I
that's
guess the
impressive.
office, whoever the office contacted, sent out people and it worked beautifully.
Okay.
But it was, and I was very surprised that it worked as efficient. There was actually a parks person in his car riding along, and I told him that there's a person there and there, and he's, yeah, so, but, the office were very, helpful in getting it.
That's great, yeah.
I'm also pleasantly surprised. Usually it is not that easy.
Yeah, well.
So you're talking about the Office of Homelessness, is that, are you talking about the?
No, I called here.
Like
Oh,
CB6 office
CB6,
here.
oh, no, I
Someone works
meant-
magic here.
I'm honestly surprised too. Usually it's not that easy. Believe me, it's honestly, concerns about like unhoused individuals on the street are among the most challenging constituent service requests that we deal with.
Okay. All right, so moving on to agenda item number 2. Kratom. So, a couple of months ago, I think over the summer sometime, a constituent emailed the office, about Kratom being sold at bodega in our district. And so, I honestly had not heard of Kratom until that email came to me. So I went like figuring out what exactly is it. And so basically it's a plant native to Southeast Asia. It is traditionally used for painkiller and anxiety and things like that, but in low doses, like it can, so what is it? In low doses, it can produce stimulant-like effects, and in high doses, it can have sedative effects. It can also lead to psychotic and psychological and physiological dependence. It can also lead to hallucinations and a bunch of other problems. It's addictive. FDA doesn't really have like, not enough data or studies are being done for FDA to say that it's actually helpful, or, you know, if there is any benefit, but FDA does say like, don't use it as an alternative. A lot of people are using it as alternative to like opioid addiction and also to cut their opioid addiction, which is like, I don't know how the two kind of go together, but people are using it for both. And there have been a couple of deaths like that have happened as well. It's generally used by the demographic that mostly uses it. Turns out it is white men ages 30s and 40s, in their 30s and 40s with college degrees. And I'm like, all right, that's pretty specific, but that's.
Are they using it for recreation or
Yeah.
for medicinal purposes?
Both, like.
Or for a caffeine kind of type stimulant.
All of it, like,
Yeah, like
they're
speed or
depending on
whatever.
whatever their use is. Some are using it to kick the opioid addiction, some are using it because, you know, they want to get the kick from, like, similar to an opioid addiction. Some are using it as painkiller, some are using it to like self-treat themselves for anxiety and depression, like
That's
it's.
what it's called on the street.
Uh,
Is that another name?
Yeah,
I'm
there are a
just saying
bunch
in
of
terms
like,
of us being cautious.
yeah, I mean, I found some names that are used in Southeast Asia, but I think here it's just labeled as kratom. And so there are, so it is legal in the state of New York. So when bodegas are selling it, they're technically not violating, they're not breaking any laws, right? So they're not really doing anything illegal. So that
At
them
this point.
selling it at this point, it's really nothing that they're doing. They're not doing anything wrong, right? They're not breaking any laws. But New York State is aware of it, so there are a couple of bills that are in the legislation right now. So let's see.
And many states do have.
Yeah,
laws around it.
a handful of
Or
states.
Just totally, you can't.
A handful of
use it.
states do have some laws surrounding it. But in New York, there are a couple of them, so those are the ones. So the first one, 2340. It basically limits the sale of kratom to people under the age of 21. And if they do sell it, it adds civil penalties for selling it to people who are under 21. And it also asks them to ask manufacturers to post a sign that says selling kratom to, or stores to put signs that says selling kratom to individuals under the age of 21 is prohibited by law. That one did pass the Senate and the Assembly.
Okay. But the
the-
sign, the ones about the signs.
Yeah, the one about the sign and not selling it to anyone under the age
Under
of 21.
21.
Yeah. The next one, 2699, I could not tell the difference between that one and the first one, like
I
2340. I like looked at it like a while. I could not tell. I don't know what the difference is between the two. And then the third one, 4034, it basically just puts kratom on a controlled substance list, like scheduled controlled substance. That's it. And then the next one, 5852, it requires kratom products to have warning labels. Product that says product has not been approved by FDA. It has then list side effects and prohibits labeling kratom as all natural. Because a lot of these right now as being sold, they are listed as like all natural.
But
So.
are they all natural?
Probably been
that-
synthesized.
so-
in some way, yeah.
So that's what this does, and that one also passed the Assembly and the Senate. And the last one is again 8693. It's again similar to the one above, 5852. And there are civil fines and that are higher, and it also enacts the Consumer Protection Act. So these are the ones that are working their way through the state right now. So I guess my question is, are there any that we wanna, let's say, either have the sponsors or somebody from the office come and kind of talk to us about it, if there's anything we want to support or any, you know, like, basically kind of, I want to open it up for the discussion here.
I think it would be nice to get ahead of the curve because like the other substances that now proliferate, especially our district. It's not that people didn't know, but because there wasn't enough advocacy and education about it. Now, you know, we know they're more sort of not, I'm not even sure if they're lawful or legal. So many smoke shops all over the district. I know my own neighborhood, is surrounded by many that are not supposedly legal. So I just wonder if this will become in the same category, maybe something in a newsletter or something, at least to warn the district this is something they should be knowledgeable about.
Okay.
Because I certainly had not heard of this.
Same,
designation,
like
but-
I said, I hadn't heard of it until, I got the email from the office, so.
And I had not heard of it until.
So
we
someone
got that
told you.
email.
So
Yeah.
I think it's important to get the word out, at least
Yeah.
in some fashion, that this group agrees.
Yeah.
it's the right way.
So, so on the DEA's website, they have like a little fact sheet and it says mostly abused by oral ingestion in the form of tablet, capsule, or extract. The kratom leaves may also be dried or powdered and ingested as tea, or the kratom leaf may be chewed. So, yeah. Go ahead.
Personally, I would support the first one. I mean,
Yeah.
I don't think we want this sold to children in the
Mhm.
neighborhood, so that seems like an easy sell. No, pretty straightforward resolution to just support not selling this to
Mhm.
children. As far as if adults should get it or not, I mean, I'm not sure how well that works because heroin's illegal, but God knows how many heroin deaths a year we have, so
Mhm,
I'm not sure that's so effective making products illegal, but just saying
mhm.
not selling to children seems like a
How
Good idea
widespread
to me.
is this?
Hmm?
How widespread as far as usage is it?
As of now, it's not super widespread, but I don't remember the exact numbers when I was reading about it, but it has increased in the last few years, like the usage has increased. Like there are more people using it, let's say, right now in 2025 than there were, let's say, in 2021 or 2022.
Yeah.
So, yeah. I don't remember the exact number of like how many more people now versus then, but I do remember thinking, wow, it's increasing.
And with our Secretary of Health saying you can't take Tylenol, you know. Just take naturals. Actually, today, they said,
Good point.
men who've been circumcised, have a higher degree of autism. That was today. That was today.
The NIH was saying 0.7% of individuals in the US have used Kratom in the past year. That was in 2021. So it's actually pretty common.
Yeah.
Yeah,
And I
Yeah.
didn't even know
Exactly,
about it.
right?
You told me
Like-
about it, so, but actually, you know, if it's
It,
probably around 1% of the population is doing it. so
Yeah.
About 30 million people.
yeah, so it's, yeah, when I read those numbers and I was just like,
But that's.
that
what
is, I have not heard of this, and it is, a lot of people are using this thing.
Yeah.
Where are the manufacturers coming from?
I'm not sure where the manufacturers are coming from, but it's legal, so I'm assuming anybody and everybody can probably manufacture it. And one of the bills does, when it does mention that the manufacturers will need certain, like, follow regulations and stuff, but I think that was the Consumer Protection Act part of the legislation that did talk about that. Like I said, I didn't read through it very much in detail, but I do remember, I think that was the one that mentioned it. But again, the DEA and the FDA don't have enough data to even say that this is safe in any way to use. Yeah,
But it was clearly brought to the attention of elected officials, right? So they're.
yeah, clearly,
And
yeah,
for all we know, there may be another street name, we just don't know it.
yeah.
And so the proliferation will be greater than what we think, but do you know who brought the first legislation? Is it a group of electeds? Sometimes it helps to know
The
who
first
brought
one, I think can we pull it up? I don't remember. Was it Bennett?
I would need to, the 2340,
Yeah,
I would need to look it up.
Well, that's so cool.
Component.
I'm just wondering if it might be worth to have them come and talk to us.
yeah,
about
so
it.
that's the other thing I wanted to know, if we're
Yeah.
supporting it, then do we wanna have somebody from one of the sponsors or somebody from their office come, see if we can try to get them at the November meeting?
That makes sense.
So it's manufactured in Southeast Asia. What they do is they harvest the leaves, they're processed and then exported to various countries, including the United States, where they're sold in different forms.
Oh, okay, so it's manufactured in Southeast Asia, okay,
I certainly agree with Barack.
yeah,
I do too, and
Yeah,
that's a no-brainer, that one of keeping it out of children's
yeah. All right.
start to begin.
So we can maybe reach out to one of the sponsors of the bill and see if they can come talk about it at the November meeting?
Or at the very least, like, since since the sponsor doesn't overlap with us, maybe asking one of our like assembly offices,
Yeah.
whether they have it, like, if they can connect us with.
Yeah.
Whoever did
Yeah, Assembly or Senate, right, like,
Exactly.
okay,
Mhm.
so we can reach out to Kristen Gonzalez's office, Assembly is kind of right now. You know, in flux. With Harvey possibly not being there for a whole lot longer,
Yeah. So
so.
there's also Alex Flores, so.
That's
Flores-
true, yeah, we can
yeah,
also reach out to
Yeah,
Alex
there's
Flores,
many
yeah,
Other assembly
we
members,
can
we can
reach out
reach
to
out to many.
yeah.
Yeah, we can reach out to Flores or to Kruger or.
Yeah. Let's reach out to and see who can. we
Alex
can
Flores is on
maybe-
paternity leave, but we can reach out,
Yeah.
there's many others we can
Yeah.
reach out.
Yeah. Yeah, we have,
Like a search.
we have
Yeah,
options.
so yeah, let's do that, and then,
9% of American adults currently use it.
yeah.
Wow, that's a
That's
big
a lot,
number.
yeah,
I
it's
think it's
just
a
pretty,
10%.
and that's the thing, it's also pretty addictive, so like, you can also get withdrawal symptoms from it and everything, yeah. Yeah, go ahead.
Making.
think another concern too is because it's not regulated by the FDA, there's such a high likelihood of contamination.
Yeah,
Yes,
exactly,
that's
that's,
exactly.
and some of the deaths that were reported were said that it was either through, because of contamination, or they were used in conjunction with some other drugs, and you know, like, yeah. So yeah, definitely, that's also a risk of contamination, because this is definitely not regulated in any way. So. All right, so,
Thank you for bringing that to our attention.
yeah, so,
That's the community member.
yeah.
I mean, wow, put it on our radar fast though.
Yeah. All right, so we'll reach out to one of the electeds office and see if we can try to get them for November for 2340.
Yeah. Now, one thing to keep in mind, if I saw correctly with 2340, and I'll share this on screen for anyone watching at home. It's been passed by the Assembly and the Senate already, and it just needs to be delivered to the governor and
Signed.
signed by the governor, so.
Okay,
And there's really only until the end of the year for the governor to sign it, so. Like.
But they're
if-
not in
if-
session until like January, right?
Correct, so where I'm going with this is if the committee wants to do something on this topic, there is a little, like, namely if the committee wants to push the governor to sign this. There is a little bit of, a time crunch,
okay.
because the year's end is quickly approaching.
So, question, let's say can we have a temporary resolution written by November meeting, but then also have somebody from the elected office present at that meeting? Like, can we
Yeah.
do it together?
Yeah, absolutely.
So that way, somebody from the elected office can present, we also have a resolution kind of that we can vote on at the November meeting, so then at December full board. Then it can pass it, because we meet right after the full board, right? So,
Yes,
so for us, if we do it in November, it's not gonna get voted by full board until December.
yeah, absolutely. Yeah, you can
So,
do that.
okay, so then in that case, anybody wanna write the resolution? On this one, just kind of take. Like, see.
I have one resolution I'm writing.
Oh.
Lot of writing.
All right.
You know, for parks, I'm writing a long one.
Yeah,
Mm.
it just works. You know what, I can give it I've done enough research and reading, I'll give it a shot. I
People do mind if I shadow you, because I've heard resolutions, so it's a lot of legalese, but.
yeah, I mean, I think I've written one, maybe two, but, yeah. But I know I can always ask Marty for suggestions, you know? But, okay, so then I'll try to have something written in the next couple of weeks.
So I'm happy to help you in any way.
That's awesome, yes, thank you, yeah, I'll take that help.
No, I'm happy to.
All right, so we'll do that for November for Kraton. And then, all right, so the last thing on the agenda is the resolution. Gabe and I talked about it over the summer. Gabe actually wrote the resolution, but then as we talked about it with Sandy, she was like, it makes more sense for this to go through health, and then, land use committee will write another resolution about what should be done with the space, just, so for the committee or community. So yeah, if anybody has any questions about the resolution, or do we want to just vote on it, or?
Does the resolutions indicate, I'm sorry, I didn't read it. Does it indicate what, Bellevue, NYU, and, the one that's down, well, that used to be Beekman down south, which is now Presbyterian downtown. What capacities they have to have covered this closing?
The resolution doesn't specifically mention all of those specific hospitals, but it does mention that the closure of the hospital has left us with a lot less number of beds in our district than the citywide. So,
But the resolution is not addressing any solution, it is just identifying the issue.
yeah, because,
There isn't any
it's,
solution as of now.
we're just asking the electeds to try to come up with,
Something.
work with the private, insurers or private hospitals, or do something, yeah.
I did read the resolution, and I don't think anybody would oppose more hospitals.
Yeah.
It'd be great to have a hospital in every block. Beth Israel lost $1 billion over the last 10 years.
Oh my goodness.
So I think healthcare funding is in crisis. In fact, it shut the whole government down right now as we speak. So I think to ask for hospital, but not talk about healthcare funding, or maybe that's just a separate resolution, is healthcare funding, but it just, I don't know what the word I'm looking for, but it's almost like a budget request, you know what I mean? Because it's like, can we have $1 billion?
Yeah.
please?
The reality of actually implementing something requires
But
that.
nobody's gonna oppose a hospital. right?
Yeah.
Thing is that in the city over the years, all the hospitals have been closing wings.
Yeah.
They've been decreasing the number of inpatient beds. Some of it because of staffing, the expense of nursing. And some of it because it's just the way they just were not needed.
I mean, when we visited Bellevue, they weren't at 100% capacity.
Yeah.
Is that because of issues of insurance?
They just weren't,
No,
and
they-
they are taking on more patients. They know that they have more patients given the Beth Israel situation.
Yeah.
A lot of these hospitals are just taking them in. I think for me with the hospital, it's more about things that need quick attention. Like stroke or heart attack, like how fast can you get to a hospital? But regular care is a little different. And I
Yeah.
think the concern always was the more emergency situations, which was the emergency department, which was the big concern of them closing. So hey, listen, I'm not gonna knock any bill asking for a hospital, but our hope of getting one.
Listen, I agree with you on that one, and I agree with you with what you said. This is just more,
We just
like,
gotta
I
put it
feel
on
like this
record.
is just putting it on record kind of a thing.
But I'm wondering if like Lenox Hill, I know there's been a whole furore on the Upper East Side about it, but if larger hospitals can have like a satellite unit here, because clearly for some reason our district is disadvantaged in so many ways, the fewest green spaces of any district, the worst air quality of any district. And so now this too, given the needs
Yeah.
of this district, we don't have enough. Wonder if maybe there could be some kind of a satellite,
Yeah,
even if they're in operation thrice a week.
yeah.
Something, I don't know whether
Yeah.
funding wise
Isn't
it
that what they
gets
did
workable.
to What used to be the I-ear on 14th Street, it became.
Yeah, that was a big
urgent
hospital,
care.
but
Yeah.
that also,
Yeah,
Yeah, and that urgent care, we didn't have any update on what's
yeah,
going on there, right?
yeah, the
Wasn't
new
sure if
urgent care, the
Sinai
Mount
set up-
Sinai urgent care, have you been getting any updates on that?
I've not heard anything.
Yeah,
Yeah,
that'd be.
I think we
interesting to
would
know.
like to reach out to them and see what's going on.
I work for Mount Sinai,
Okay.
full disclosure. There is an urgent center in, on.
Yeah, the one they opened
Yeah.
up
It
after
is, it is
the,
open.
oh, yeah. Yeah,
The
so,
numbers were not, you know,
Yeah,
they
the
just started when they
utilization,
came
yeah.
in, right? And the numbers weren't that bad. I'm just wondering if it's grown or if more
Yeah.
people have gone.
I don't know what the numbers are, I just know it's open.
yeah. They're still 24/7,
Oh, that's a good one.
because that's the one of the things, right? They had to be 24/7 for like, I forget, but some
Somebody asked
number of
about that.
time, yeah.
I don't wanna say the wrong thing,
Oh,
I'm not sure.
yeah, that's fine. We can always just reach out to them and try to see if we can get
It'd be
information,
good to
yeah.
get a follow-up on.
Yeah, exactly. We can ask for a follow-up on
I
that.
think the issue is so deeply intertwined right now with the parallel issue of health insurance,
Yeah,
be it Medicaid or anything else. I think that is also keeping patients away.
yeah.
Well, that's.
According to the Mount Sinai website, their urgent care center at 310 East 14th Street is open 24 hours. 7 days a week.
Okay,
Oh, bless
So-
their hearts.
At least as of.
yeah.
I can't anticipate the future, but.
Yeah, but maybe, I think it's a good idea to reach out to them and get like an update or, follow, yeah,
Yeah, just let me know what specific.
yeah.
But I think what you're saying is so relevant regarding people are so afraid of health insurance that they're not gonna get, people don't seek care. So we don't even know what level that is at right now, right?
That is
Yeah.
a huge issue. People are
That's huge.
terrified to go to any of these facilities.
Yeah.
Yeah, that's a big one.
So,
I mean, they're
Right.
Medicaid
People
especially.
are not even going to food pantries, so they're not gonna go to a hospital. They're terrified.
yeah, all right, so do we want to vote on this resolution?
Also,
Oh,
I see Karen.
oh, sorry, yeah, I have a,
Especially.
Karen.
Especially since Karen.
Is, yeah, Karen,
President of the CAB.
yeah, chair of the cab,
Yeah, chair.
yeah. So go ahead, Karen.
Can you scroll up to I had a question. It says you want something north of 14th Street. And I guess,
Go
so,
right down a little, right there. Is that what you're talking about?
yes. So you
Okay.
say the closure has left it below 14th Street, and then you ask for more support north of 14th Street. And I think you mean below 14th Street.
Oh,
I read it
you know
wrong,
what? You're right.
or I read it wrong.
So correct this to above 14th Street.
Yeah.
No, below.
No,
it's
well,
not below, she's saying that's
No,
fine.
no, leave that below and then scroll down. Scroll down, keep going. North, you want a full service inpatient facility north of 14th Street. Well, that's 27th Street. You want it south of 14th Street.
Yeah.
But
No,
that's not our district, right?
Yeah, that's why I was going to interject. So, yeah,
No,
our
I would-
district starts at 14th Street,
Yeah.
Then I
so.
would take away north of 14th Street, they're just gonna tell you there's Bellevue and NYU. NYU doesn't really do inpatient, but, well, I'm sorry, inpatient psychiatric, but they're gonna refer you to NYU and Bellevue. So, and MSBI was frankly never fully was below capacity for many, many years. That's why they lost funding. They had a policy of creating what's called quote unquote centers of excellence. So therefore, if somebody went to Beth Israel and they had a stroke, they'd be stabilized and then shipped up to 104th Street to the stroke center. So they established centers of excellence throughout the city in their other facilities because they knew they weren't going to keep Beth Israel because the hospital was so old that they would have to gut they'd have to gut the building to bring it up to code. So part of the reason why it continued to lose money was because they just kept services away because it was a transition plan to close the hospital. Remember they said they wanted to close the hospital in 2018. So I'm not saying, so I think your request, I guess it's a very long-winded way to say, I'm not sure you should include, I'm not sure whether or not they're going to take the resolution that says call upon elected officials to immediately engage with potential to establish a full-service inpatient facility. What you might want to say is to immediately engage with hospital providers to ensure that they are picking up patients from MSBI's lost capacity. I mean, when MSBI closed, they were at 14%. In 2019, they were complaining about nobody was going there. The only thing that was keeping them alive was the maternity service from Brooklyn. So, so maybe one suggestion, and then I'll shut up, is to ask for something to ensure that they are replacing MSBI's lost capacity. But asking
Okay.
for a full-service inpatient facility north of 14th Street, they're just gonna say, well, you already have Bellevue and NYU, what's the problem? And,
Yeah,
Sure.
that's
Good point.
a good point,
Mhm.
yeah. So let's,
and
yeah.
so however you're gonna word it, and the urgent care center that's open 24 hours a day, it's open 24 hours a day for non-serious illness.
Mhm.
true,
Yeah,
So really, they're just keeping those, they're reporting their 24-hour work, because what's gonna happen next is what's pretty obvious, which is saying, look, we only have 3 people between 11 PM and 8 AM.
yeah,
We'll
yeah.
just close it, and it'll be at urgent care center. So really, you're looking to ensure that the capacity is picked up by other hospitals, but given the city's financial crisis, they're not gonna be able to provide a new provider. Okay, that was it.
Yeah, so, go ahead. Yeah, so let's, yeah, I think that's true, let's reword that last thing to say, what was it, the lost, to establish lost capacity, or what were the words you used, Karen?
Oh,
Oh.
let me. Karen, you should be able to talk again.
So what you're looking for is Community Board 6 calls upon elected officials to engage with potential hospital providers to ensure that, because you're not going to tell them who's going to do it, to ensure that that MSBI's lost capacity is replaced.
That MSBI's lost capacity
Yeah,
is,
any capacity lost from the, MSBI closure is replaced.
ensure that MSBI is, lost capacity from
That the
Yeah.
lost capacity from that
Closure.
MSBI closure.
lost capacity from MSBI closure, yeah, that makes perfect.
So that they can say, yes, and we're trying to do it, and we already worked out with Governor and downtown, and they'll tell you how the capacity has been replaced. So that's actually a kind of an interesting thing you could do for your meetings. How has the capacity been replaced? I know Bellevue's doing something. I'm already doing it. We know NYU is expanding their ER. So, because they got money, so we think it's being replaced, and I'm not really sure who you would ask to say, has it been done? Oh, Brad Hoyleman.
Yeah.
He's a pretty smart guy. He could pull that info together.
Yeah, so then I think we should also readjust the next be it further resolved, because it also states that commit to constructing a new public hospital. Right?
Yeah, I mean, Bellevue's got 850 beds. NYU has slightly more, I believe, except they only take people except their patient population differs. So they're not going to build a new hospital. When you take health economics, they're all moving away from hospitals. That's why everybody has little mini clinics all around, because you can charge hospital rates, but work 9 to 5. It's a real moneymaker.
Yeah. So then the next be it further resolved, do we want to keep it or take it out?
Well, you might want to say that capacity, including emergency services, surgical capability, and adequate hospital bed capacity. So you might want to take the, emergency service, surgical capacity, and adequate psychiatric bed capacity, and stick it up in the previous one that the lost capacity in terms of emergency, or in parentheses, emergency services. Yeah, so put that after capacity in parentheses. And then delete that,
Yeah.
yeah. Oh, sorry, that's just how I would do it.
Mm-hmm.
That makes sense.
Yeah. Any replacement hospital must offer, I think we can take that one out too, because we're not doing a replacement hospital,
Right.
right?
Or the replacement services must be.
Yes.
Yeah,
Yeah.
replacement
Offer
services must be
equitable access.
equitable access,
But
yeah.
if you say replacement services must offer equitable, oh yeah.
Yeah.
Then you won't take anybody if they do that, but screw it, you have to put it in anyway.
The replacement, instead of hospital, yeah, services. Must offer equitable access and align with, yeah. And then the last one there, be it further resolved that CB6 urges the New York City health as a condition.
Yeah.
Having commitment to maintain and pay, yeah,
That's.
yeah, that's good. That one,
That's
I
important.
think that one's good.
I think that's
Right.
great.
All right.
Now, okay, now the title, is the
Mhm.
committee good with the title?
Yeah, because we are no longer replacing replacement,
Replacing capacity.
yeah. Replacing, yeah, to secure, lost capacity.
Yeah.
Yeah,
Replacement of lost capacity.
And then the second piece, and to commit to a,
No,
That's
yeah,
not necessary.
yeah, you can take that one out. Replacement of lost capacity. Well, yeah,
and then scroll back to the resolves. Just to make sure the committee is good.
Brian, just mute me, because I'll stop talking.
When I had maternity. I was born there, by the way. The building that I was born in, which was the northwest corner, which is now a beautiful condo, that building had the maternity hospital where I was born.
yeah,
You could call it inpatient medical services.
Yeah.
yeah,
Another option for the committee to consider is maybe not even worry about specifying like emergency service.
Right.
Like just
Oh, just the
Yeah.
lost capacity
Just leaving it-
overall.
leaving it a little bit permissive.
yeah.
Yeah, because that
Just-
way, as he's saying, we can have.
Yeah, because there's so many services that you
Yeah.
can then start to add, right?
Exactly. So I wonder if the
Yeah.
committee would want to
Just get rid of that,
You
yeah,
don't need to specify.
yeah. Yeah, cause this
Mm.
leaves it open for many things,
You're welcome.
Good point.
yeah.
Yeah.
Yeah. All right. Is it good? Do we wanna vote now?
Yes. Yeah.
All right.
Okay, members, when I call your name, please say whether you are in favor, opposed, abstain, or not entitled. Marty Barrett,
For.
Ellie Barroso,
In favor.
Rock Friedman,
In favor.
Gloria Haig,
In favor?
Rupal Kakad,
In favor.
Emma Bean Siddiqui.
In favor.
With all 6 committee members in favor, this resolution passes.
All right,
Excellent.
today. All right, so moving on, chair's report. So Sandy, Gloria, Jesus and I toured Bellevue, as Gloria mentioned, with Karen Moore, the chair of Bellevue CAB, and Sage Robinson from Public Affairs Department on September 12th. I mean, Bellevue is, like she said, an amazing institution, but
I was blown away.
like, I was so beyond blown away. It was just amazing. But here are a couple of just highlights that just really blew me away. There are over 90 specialty clinics in ambulatory care, and Bellevue is one of the only hospitals in the tri-state area that can treat rare infections like Ebola. All of the most complicated cases in the New York City public hospital system are sent to Bellevue because it's a world-class facility with some of the best doctors in the country. There were over 772,000 patient visits last year, and the wait time to get people admitted went from like a few days to the same day. And they're on track to increase that by about 20% this year. All of Bellevue doctors are affiliated with NYU Medical School. Bellevue has won accolades from American Heart Association, American Stroke Association for best practice in heart failure and stroke, and has centers of excellence for comprehensive cardiac care, cancer care, trauma, World Trade Center, environmental health, and other services. The ambulatory care clinics will move to the new Spark building when it's complete, freeing up hospital space for additional innovative Bellevue programs. Bellevue is the only public hospital in the city that has ECMO, which I think Brock might know more about than me, but all I know about it is that it's a life-saving medical device that temporarily takes over the function of the heart and the lungs in extremely ill patients. That was really like phenomenal to watch and go into that room, by the way. Door to triage time is 5 minutes, and the percentage of people who left without being seen is lowest, not just in the city, but also the country at 0.8%. And the national standard is 2.5%. So they're just amazing. And it is the only level 1 trauma center and level 2 pediatric trauma center south of 68th Street. So yeah, it was just such an incredible experience to have that tour. So yeah, thank you, Bellevue, and thank you, Karen Moore, and thank you, Sage Robinson, for doing that for us. All right, and any old or new business?
By the way, when my wife was with OMH, the pediatric psychiatric inpatient was under her purview. She was absolutely amazing.
Yeah.
It was totally amazing, the work that they did.
Yeah. So, as for the old and new business, so, Stop the Chop New York, oh, sorry, go ahead.
I just wanna ask if any one of us in the, in CD6 know about the medically assisted suicide that is being proposed in
Oh.
New York.
What is
New
being
York.
proposed?
It's the medically assisted suicide.
We're waiting
So
for the-
if-
waiting for the
if you're-
governor's signature.
Yes, waiting
Oh.
for the governor, waiting for
I
the
was not
governor
aware.
to
Didn't-
sign.
I
It was
I didn't know
proposed
that.
by Brad Holman. It was approved in the Senate. It's,
Had no idea.
S-138.
Okay.
Bill 2025, it was proposed.
S
It was
128,
approved by the Senate in June of 2025. And it's ready to be signed by the
It's been
governor.
kicking around for years
Yeah.
and finally it's
And-
gotten
Yeah.
to the governor's desk.
And do we think he's gonna
with-
sign it?
That's.
Is
that the big question? That's the
We
big
should-
question.
Yes,
to
that
be-
is the big question, if she's gonna.
I was
sign it.
not aware of that, and that is actually really good to hear, because I have very personal feelings about that, because my mom had cancer, terminal cancer, so, and then she was in California, and soon after, like a couple months after she passed, is when California passed it. And so I wish California had
Yeah,
it before my mom, right? So I've been through it, so for me, that is a very
It's.
personal one.
Sure.
There are six.
So I've
states
seen what
that have
terminal cancer can be for somebody you
I've
care
been a member
about,
of
like,
Dying with Dignity for
yeah,
about 30 years now.
yeah,
It's
so,
been
yeah.
My
a long
kids
haul.
were, 88 years old and kind of losing it and going downhill,
Mm.
basically starved himself to death.
Yeah.
Because there was no other way for
Yeah.
him to do it.
So
Which,
what do you?
Yeah,
accepting that is really
so-
hard, but you have to
So-
support people
It's-
what they wanna do.
I do wanna
Interesting.
support it, but then somebody has to write the resolution by next meeting,
Shouldn't
because,
we?
like we
I-
said, like December is
Yeah.
when we have to do it, so. I'm already writing one
I think it'd
resolution,
be
so I'm gonna,
Fascinating to see it go in front of general board.
yeah. So, like I said, I have personal
Because I think
experience.
People have very
That's
strong
right.
feelings both ways.
So,
I'm a man.
all right, so you two will write it?
Yeah.
All right, so then we'll have possibly 2 resolutions to vote at the November meeting that'll then go to hopefully the full board if it passes up.
Though in non-Catholic hospitals in New York City, if you're inpatient and you're in lots and lots of pain, and the likelihood of you coming out alive, you will get an extra dose of
Morphine?
of morphine.
Yeah.
That'll help
That's
you
a big
through.
deal. I mean,
Yeah.
In New York City at any rate,
Yeah.
you know.
At least as of now.
Yeah.
The only old business I can remember is before we adjourned for the summer, we had talked about a health fair. And we bounced that around and
Yeah,
nice.
that's right,
Our
yeah,
friend from Mount Sinai.
Yeah.
Is gonna help us do that.
so yeah, so we
We have to
can,
follow
yeah,
up
we have
with
to
that.
follow up with that. And before we adjourn, I have one other thing, actually. So Stop the Chop New York, New Jersey is advocating for elimination of all non-essential helicopter flights over the New York City. They work with residents, community boards, and elected officials to address noise, safety, environmental impacts, and to support policies that improve quality of life for New Yorkers. And they've asked to present to us about it and asked us to kind of support it. They have already presented to CP7 recently, and CP7 did pass a resolution to support that.
We have
And so
helicopter resolutions passed by CB6 over the years.
we have, right?
We
That's what I thought, but
We have
yeah.
had a few.
Heliport.
Yeah.
No, helicopter. Oh, it may not be on the list that we have in the thing that you put together, but in the files, there are resolutions. At least two in regards to helicopters, written by Lou Sapersky,
So,
when he was chair of transportation and
yeah.
whatever.
So yeah, they've asked to come and talk to us and present to us, so I say yes on that. So, all right, so we'll reach out to them and try to figure out when we wanna have them come present to us.
Okay, I'm just an optimist, so just bear with me. This is how I live. I know we're in a crisis of Medicaid and Medicare and the country's in a crisis, but I really want to keep Be Heard kind of in front of us.
Okay.
We do have elections coming up. I'm really hopeful there might be a tide change and we're in a mental health crisis. Not just in New York, but across the country.
Yeah,
So just want to keep it on our radar if
Yeah.
we can.
yeah, by the way, speaking of that, Gothamist actually had an article earlier today about that very thing that I read about, and yeah. Yeah, they talked about like how, they basically visited a couple of neighborhoods that did vote for Eric Adams because of the crime and everything, and basically Gothamist visited those 5 neighborhoods. And, with more than 24 residents interviewed disagreed who should be their next mayor, almost all voiced support for frontrunner and Democratic nominee Zohran Mamdani's proposal to have police focus on serious crime and have clinicians handle mental health emergencies where the risk of violence is low. So it's a very popular,
Topic.
We'll keep it on our radar.
so yeah, we should.
We'll see how
definitely,
things play
yeah,
out. I'm an optimist, sorry.
yeah, so.
I'm not.
Oh,
And
come
I-
on, you.
And I've always been very optimistic, but,
And,
It's hard these days.
it's really tough.
Alright.
You know,
Excellent.
with these
With-
current indictments, I think going forward, this is only 9 months in. You know, in year 2, we'll start seeing people disappearing. And in year 3, maybe just shot.
You
You know,
stay on
it's-
track.
It's tough.
the,
It's really
Yeah.
sad.
so,
I'm
unless
presenting in
somebody,
Mhm.
huh?
So it's even happening in schools,
Yeah.
which is so terrifying.
Yeah, and unless anybody has anything else, meeting adjourned.
Yes,
All
excellent.
right, meeting adjourned at
Thank you.
8:01 PM.
Excellent.
Very